Good day, physiotherapy students, and welcome to Therapeutic Massage. This will be your theoretical lecture, and this is part 1 of a 3-part series. At the end of the 3-part lecture series, you should be able to know the following: understand the history and development of massage, understand the physiological and therapeutics effects of massage, as well as the general uses, indications and contraindications of the different massage techniques. Be able to discuss the effects of massage, where you would want to tell your client why massage is beneficial, where it is indicated to use, and where you should not use it when it's contraindicated. For you to develop the necessary skills and coordination with your hands to perform therapeutic massage well. Develop the observational skills so that you can detect the patient discomfort or any changes in the condition while you are massaging. Understand your role as a physio and the hands-on approach of physiotherapy. The implications of touch, professionalism, and counseling as well. Because often this is where the patient feels comfortable to share their feelings and emotions. Develop the critical thinking skills as well as the academic and life skills required. So in this first part, we're going to look at the following learning objectives. It's an introduction. So where does massage originate from? Context of massage. Going to look at the biological effects and the basic anatomy. An introduction. So massage is a scientific way of treating some form of disease by applying external manipulations and on a variety of the different soft tissues, for instance the muscles, the skin of course, and the fascial lining. Therapeutic massage can however not be practiced by instinct alone. You do need to understand the biology behind it and your anatomy, of course. Therapists who practice holistic therapeutic massage need to be experts in human science and psychosocial skills. There is, however, professional rivalry. It may be a barrier to advancement in therapeutic massage because there are sports masseurs, massagers, and so this can be also cause a bit of rivalry as well. But continued research is required to maintain massage as an evidence-based therapy. So the origins of massage dates back many years to China, India, Arabia, Greece, Italy, and Egypt. Biological basis of massage. You have to understand the anatomy and the physiology of the body tissues. You will affect the horizontal arteriovenous plexi, and these are structures that lie at the skin interface, and it can be highly influenced by massage. The skin dermis gives a mobility to the skin which can be maintained or restored by massage. So here you will see the osteology, a human skeleton. So you can see the cranium, the skull, the mandible. Then as you go down, you will find the clavicle, and also the vertebral spine or the spinal column. As you can see, just below the cranium, the spinal column starts with cervical vertebra, 7 of them. Then your thoracic vertebra, followed by your 5 lumbar vertebra, your sacrum ending with your coccyx. So, attached to the vertebral spinal column is your rib cage, then your arms, your pelvis, and then moving to the ground, your femur, the biggest bone in your body, your patella, your tibia, and then your foot bones. Here you can see how many muscles there are in the body. And it is important for you to know the major muscle areas of the body. So, go through your atlas and know where, for instance, your trapezius muscle sits, your latissimus dorsi, thoracolumbar fascia, as you can see on the back, gluteus maximus, your hamstrings, the back of the leg, posterior part, your gastrocnemius and your soleus. These are the big muscles sitting on the back, the posterior part of the body. When we move anteriorly to the front, you will see your pectoralis major, your anterior deltoid part, biceps, going to your legs, your quadriceps, your tibialis anterior. So many muscles, but it is important for you when you massage that you know where you are and on which muscles you are. So be sure to, when we get to our practical parts, that you think of, but where am I now pressing and massaging? Am I on the back? So then, am I moving over the lats, the trapezius muscle, parts of the posterior deltoid, so that you don't just massage without knowing the muscles of the body. So here we're going to look at the anatomy of the skin. It is important because we are massaging on the skin itself. You'll see the hair follicles, and the skin is divided in an epidermis, a dermis, and a subcutaneous tissue. 3 layers that form the anatomy of the skin. So can you see the artery and the veins comes from the subcutaneous tissue layer and through the dermis and also the epidermis. So as we massage, these are the aspects of the skin where the artery and the veins are actually very superficial in the skin, where you can cause with your massage a redness or where the increase in temperature occurs. Let's take a look at this stress-strain curve. The fibers in the tissue can be overstretched beyond their elastic limit, causing damage. So failure of fiber bundles occurs beyond their yield point, and this can be prevented by not stretching tissue beyond its end fill. So you can see there the Y is the yield point. So what does that actually mean? It means that the skin has got an elasticity in it, as a muscle do. But there's a certain point called the yield point, where if you stretch beyond it, then rupture can occur. So it depends on your patient. Everyone is slightly different. For instance, let's take a young athlete, skin very supple. Let's take even a gymnast. Muscles are very, very supple. It allows a bigger range of motion in the joints. So their yield point will be higher. You'll have to actually really stretch very hard to cause any damage or rupture. But in contrast, let's take a geriatric patient, an old lady with very fragile skin. The yield point of her skin is much lower and will occur earlier on, so you will have to take care when you massage her. You won't be able to stretch her as far or move her skin as much, and you need to take care with her, the geriatric patient compared to the gymnast. Massage principles works within the elastic limit of the stress-strain curve. So you will see the gray highlighted area. This is where therapeutic massage takes place. We never work into or beyond the yield point. But you can take it up to the elastic limit, the E in the graph. Massage provides a low repetitive load over the medium term and may create a creep response by which the tissue is permanently elongated. So this is now where, let's say for instance, a surgical scar has healed, there's no stitches in, there's no open areas of course, and where you actually have to move that scar to elongate the scar tissue, because you don't want a tight and stiff scar limiting range. So you actually want to then move and create that creep response so that you can get that connective tissue to move more. Let's take into consideration these following aspects. Remember, massage should not be done too quickly to avoid a stiffening of the connective tissue as a result of the viscoelasticity properties. Dry tissue should be managed slowly, as friction will be produced between collagen fibers. Okay, so not too quickly, and dry tissue, you should add a massage oil or a lotion even if you don't have a massage oil. The effectiveness of the nervous system can be enhanced even by massage to aid removal of excess tissue fluid by increasing its pumping effect with massage. Did you know that lymphatic drainage can be increased with your massage technique by a pumping effect and a pulling of the filaments, which opens the gaps between cells in the walls of the lymphatic vessel? The muscle spindle can be stimulated as well or caused to accommodate by massage, producing a change in the muscle tone of the muscle.